Do you feel, especially after 50 years and older, regular stiffness, pain, reduced mobility in your hip? You are not alone, my dear viewers. Today in 2026, our global pandemic of hip arthritis. Totally ignore your earlier warning sign, and you only take chemical medication, injections, and similar kind of approaches to your hip arthritis, and you will get worse and worse each month, each year. After 26 years working with the patient, I can tell you clearly, those methods do not stop progression of the joint damage. They only reduce pain temporarily while degeneration continues. And one of the biggest dangers today is that people try to fix problem of their own. Trust me, my dear viewers, this is my personal specialty. Almost 30 years I work with the patient with hip arthritis. If your doctors cannot help you with your hip arthritis, how, for God's sake, you can help remove your hip arthritis? With simple, easy solution that you're really trying to find. You need to think something. If you cannot put in remission your hip arthritis 100% in a couple of years, maybe 2, 3, 5 or 10 years, you will develop an unbelievably later stage of chronic condition of hip arthritis, and you will go to surgery. Do you want to be in the pain for the last 20 or 30 years of your life? And this is where all starts. And the hip joint is one of the most important load-bearing joints in your body, and over time poor nutrition, inflammation, lack of movement, and mineral deficiency begins to weaken its structure. And one of the most overlooked problems with your hip arthritis is going to be chronic deficiency in minerals and vitamins. Yes, my dear people, my dear viewers, after 50 years and older, in most cases you will have a chronic deficiency in minerals and vitamins, and you will develop, just because of those kind of problems, hip arthritis. And this is the correct way how you can help yourself. Not chemical medication, not injections, not believing in nutrition, natural remedies. God forbid you believe in minerals and vitamins. You just need to be sick for the rest of your life. You never ever in your life address the root cause of your problems. This is going to be nutrition, it's going to be mineral and vitamins deficiency, it's going to be weight gain, it's going to be hormonal disbalances, a lot of stuff. This is something that you don't understand, your doctor never tell you, and you don't believe in the other stuff. But you will believe in structural changes and worsenings of your hip arthritis. And this is where one missing mineral becomes critical. In reality, it is not just one, but combination of the key minerals that work together. Silica, boron, calcium, and magnesium. Please try remember those 4 minerals that play crucial role in your healthy hip, especially if you want to have healthy joints for the rest of your life. Silica is essential for the collagen formation and connective tissue strength. Without silica, the body cannot maintain integrity of the cartilage and the ligaments, which leads to faster wear and the joint instability over time. And the best natural sources of silica include cucumbers, especially the skin, oats, barley, bananas, leafy greens, and the mineral-rich spring water. When it comes to the supplementation, the most effective forms is orthosilicic acid or bamboo extract, with typical daily doses randomly ranging from 10 to 25 milligrams of elemental silica. Please, my dear viewers, silica is crucial part of your hip health. If you don't believe it, your hip will get a lot worse. Second crucial mineral is, of course, it's going to be boron. Please try to remember this. Boron plays a key role in calcium metabolism and helps reduce inflammation inside the joints. It supports bone density and improves the utilization of other minerals like magnesium and vitamin D. And without the boron, the body cannot properly use calcium, which leads to weaker bones and increased joint stress. And the best food sources include apples, avocado, raisins, nuts, and the legumes. And as a support, boron is most commonly taken in doses of 3 to 6 milligrams per day, which has been shown structural health and reduce inflammatory processes. And a couple more crucial information. Did you remember, my dear viewer? Silica, of course, you need each day something called boron, and you need to take each day something called calcium and magnesium. Calcium and magnesium are perfectly combine in our body. They work perfectly together for our joints, especially for the hip joints. And calcium provides structural strength to the bones that support joint, but without proper balance, it cannot function correctly. Many people take calcium incorrectly without necessary cofactors, which can lead to poor absorption and even unwanted deposits. Yeah, my dear viewers, that's why you will need help from professionals who understand all of this. You cannot just go to your locally, pharmacy. You buy first calcium, you take each day, and you don't see any kind of improvement in your hip problems. Of course, my dear viewers, because 99% of those minerals, vitamins, and natural remedies are poor quality. And you don't use them correctly, of course, you cannot help yourself. Second and most important information is going to be when supplementing calcium citrate. Use calcium citrate or calcium hydroapatite. Are preferred forms with typical daily dose between 500 to 1000 milligram. Always combined with magnesium and vitamin D. This is something crucial to understand. You need calcium, magnesium, but also with vitamin D, that those three works perfectly together. A couple more information about magnesium. Magnesium is crucial for the muscle relaxation, nerve function, and preventing stiffness around the joint. It also regulates calcium balance and reduces inflammation. Without enough magnesium, muscles around the joint remain tense. Circulation is reduced and the pain increases. And the best sources of food include dark leafy greens, seeds, nuts, whole grains, and legumes. And for the supplementation, use something called magnesium glycinate or citrate, maybe 500, usually around 500 milligrams daily. But this is all crucial information, but if you put in this structural plan, it really can help you. But your doctor never tell you this. You don't have any kind of knowledge, and you cannot find easy, quick solution. Those are all things that I'll tell you today. This is not something that you can just incorporate in your life and everything is going to be fine. Of course not, my dear viewers. So, in my clinical experience, the biggest mistake people make focusing on the pain instead of structure. They chase temporary relief instead of restoring the foundation of the joint. When the body receives the right minerals in the right balance, combined with proper nutrition and movement, the progression of the joint damage can be significantly slow and the symptoms reduce. So now ask yourself, are you treating your hip properly? Or you're treating just the cause? If this problem has been developing for the years, it will not disappear with a quick fix. And trying to solve it on your own without clear understanding can make your condition even worse over time. That's why you do each day, my dear viewers, and you come to my office. My dear viewers, if you come to my office in maybe first or second year of hip arthritis, you will never have hip arthritis with my programs of natural remedies, nutrition, physical therapy, rehabilitation. Never. But you come to my office when you are just maybe a couple of months before the hip surgery. And how you can expect, if you have hip arthritis for 5, 10 and 15 years, how you can expect quick fix overnight? How? You all treat yourself totally wrong. That's why right now it's tens of millions. Even right now, it's above 800 million people all around the world have some kind of joint problems. In a couple of years, it's going to be over 1 billion people. And everyone uses chemical medications, injections, unhealthy or unquality supplements, and something so interesting. You will have a minimum 5 to 10 years to correct all those things. Why you don't correct them? Please, can someone tell me why you are on those later stages of those chronic hip arthritis? And this is no by chance. If you want to learn a lot more about the best vitamin that really can help you with your proper healthy hip, watch my video right here. Thank you for following me, my dear viewers. See you next time. Bye bye.